The day is just flying by, and we've already heard from some incredible speakers, but it is not over yet.
Now, we're so grateful that everybody that's turning in and for your donations. Remember, this Chirothon is about expanding the awareness of the value of chiropractic, and we couldn't do it without your donations. So we're happy to report that we have collected $5,025. And thanks to our sponsors for these segments, Biotic Research Corporation, all donations, they come to the rest of the day, they're going to be matched. So understand that for every dollar that you give, Biotics Research is going to actually give $1 on your behalf too.
That's outstanding. And Biotics, this is the one piece that I think we love to have, is we love to have matching dollars. So every dollar comes in. Biotics Research has been a leader in nutrition industry for over 50 years. It's actually known for top quality supplements and enhanced product delivery systems. They drive advancement by focusing research initiatives, unique product formulations, and unprecedented quality control. Family owned with a rich history, which they're most proud of, is their valuable partnerships with the healthcare professionals such as chiropractic.
Well, I want you to, right now, watch this Biotic video.
Hi, my name is Dennis DeLuca, the president of Biotics Research. In the late 1950s, my cousin was diagnosed with a serious illness, and my father became determined to help him. The prognosis was not good, but through science-based nutritional intervention, my cousin's quality of life exceeded medical expectations. It was that illness that brought several family members together, which led to the founding of Biotics Research in 1976.
Well, we're so excited to have you here with us today. So today we have Dr. Kelly Blundy. Dr. Blundy is a relentless advocate for healthcare transformation and is the driving force behind the Spine and Health Center in New Jersey. The Functional Medicine Center of New Jersey, she began her career with a doctorate of chiropractic, helping her patients move better and feel better. But as she treated patients, she saw firsthand that chiropractic is about so much more than just the spine. It's about the entire body and the ability to function optimally. That realization drove her to go deeper into exploring nutrition, longevity, and disease prevention to give her patients the full picture at all what it takes to truly thrive. A little over a decade ago in practice, her passion for getting to the root cause of the health issues led her into the world of functional medicine. She became certified through the Institute of Functional Medicine and began to dive deep into the gut health, hormone balance, and the complex interplay between nutrition, toxins, and chronic disease. Never once did she stop learning. She went on to earn a doctorate in natural medicine to further bridge the gap between traditional and holistic healthcare. You know, to me, this is so exciting because you can just feel your passion for this subject matter, and I can't wait for you to teach us, you know, how is it that you, as a doctor of chiropractic, have now began to help so many people that would have never thought of a chiropractor, but now they have you as their main provider?
Well, first I want to thank the both of you for having me here. I love what I do, and I could talk about it all day long, but I'll try to keep it short. But, you know, chiropractic in its infancy is all about the root cause. It was always about treating the whole body, right? And so chiropractors have such an incredible foundation, and they're really lucky when they're walking into functional medicine. We learn about nutrition. We learn about organs, systems, and how this complicated system, this body of ours, really communicates with each other. We have always been the pioneers in prevention. Don't wait for a problem. Prevent it from happening in the first place. And, you know, my curiosity of just never stop asking why just never stopped. And that's what really led me to functional medicine.
That's kind of a key, Dr. Blundy, is when you start recognizing that root cause in that whole being care, treating the patient. But I think one of the big pieces for you listening today is you're thinking about, well, I'm not even sure what my problem is. And sometimes I'm feeling these problems and then they go away and then they come back. And that's a powerful lesson that a lot of doctors learn in the treatment of patients is we need them to understand that there's not a quick fix, that our body's going on a journey, and that journey takes us circuitously in different avenues. And I think that's where you are, which is you became a chiropractor, your circuitous journey was you wanted to do a little more. Tell us why you wanted to do more for the profession and for your patients.
Well, I just wanted to expand my knowledge on the body, especially because we live in America and we spend the most amount of money in healthcare. You would think we should have chronic diseases going down, and they're skyrocketing, right? So I'm like, okay, this doesn't make sense. And I think the issue is because we need to start working together. We have to stop dissecting things, that's my organ system and I don't go past there, and that's that organ system and I don't go. It's about working together. When we have symptoms, that is our body screaming at the top of its lungs, pay attention. If I could drink whatever I wanted, eat whatever I wanted, and I could take a pill and it would neutralize that, sign me up, right? But it doesn't exist. So it starts with education. And that's not just educating ourselves, that's educating our patients. You need to become your own advocate, understanding how this works, paying attention to your symptoms, because there's no rule that says you get one diagnosis at a time. And it's so fascinating. It's actually, my patients, when they come in, they like learning about it. They're excited. They're like, oh my God, I didn't even know that's how it works.
Yes.
I see a lot of chiropractors out there that, unfortunately, when we go to school, and being a past president of a school, I can tell you, we're going to teach you what you need to know for the national boards. But at the same time, as you expand into practice, you realize that there's a big population out there that we have never really supported. And Didi Palmer had that vision early on in 1895, but we've kind of stuck to the physical matter of trauma. Now, functional medicine comes into the picture. You get involved into that space. You recognize that now not only can you adjust your patients chiropractically, but you can also advise them as to the root cause of their symptoms, understanding their disease process, and more importantly, finding natural solutions. So tell me, for those that may be watching us right now and don't really understand or have incorporated functional medicine into their practice, what was it about it that really attracted you to say, I need to go into this space so I can better serve more people in my community?
I think it was more of all of the systemic diseases that were coming in. I remember the patient that walked in, I will never forget her as long as I live, and she came in and she's like, I have pain here, and I have pain here, and I have pain here, and I have pain here. And I'm like, well, what ran you over, right? Life, right? And that's when I started going, there's gotta be, I'm so thankful for chiropractic and I'm so thankful that these hands can deliver relief, but I'm going, what is this person doing on a daily basis that could be adding to this systemic inflammation? And then I started looking into food, and I even started looking into, when somebody takes a drug, what is it actually doing to their body, right? What's the good and then what's the bad, right? And all this curiosity kept going. So this patient, as she was coming in, getting adjusted, I said, you know what? Can you start eating these foods and stop eating these foods? And within 2 weeks, she came in and she said, almost 50% of my pain is gone. And that was really the turning point for me going, okay, now I need to learn more. And I think that if you can really look at a person as a whole, you'll never want to stop learning.
It's for opportune moments of being in these chronic situations, which we know now is it's serious. 90% of our healthcare dollars are spent in chronic sickness, and Dr. Fab, as you just said, dis-ease was 130 years ago with Didi Palmer, and he talked about inflammation. Mm-hmm. And now we're back to inflammation, and we're starting to get an idea of thoughts that come in that negate our health. We start thinking about the poisons that we feed our bodies, the toxins that go in.
Yes.
And then you have the daily life traumas, the lifting, bending, pushing, pulling, twisting, and all of the other things. Not to mention a bad sleep, a bad mattress, and a bad pillow. And as we start to get these relationships, there's a healing relationship that really happens. And sometimes we get in our own way, and sometimes we lose trust with our practitioner, that we think is going to deliver that care. Tell us how you build the trust with your patient and how you get them to trust in themselves to motivate them, because we are helping them heal. We're not healing them. You're healing yourself.
That is such a great question. And the first thing is, you gotta listen. You gotta take the time to listen to your patient's story. And then you have to figure out what's their why, what is holding them back, and what is this pain, disease, list of symptoms, what is it preventing them from doing? I can't tell you how many times a patient's like, oh my God, nobody's ever asked me that before.
Right.
And then that's the way that you can empower them to do the things that they need to do once they leave your office, so they don't continue to add harm, right? Like, let's just go to chiropractic, tech snacks, sitting at a computer, right? How can I empower, what is stopping this patient? What is their pain stopping them from doing? How can I motivate them in a way so that they don't go back and do this?
Right.
And it's just listening, finding their why, and truly caring, building that doctor-patient relationship.
Well, you know, to me, what is beautiful about that is that I always feel the compassion for the public, because the public is just very confused. They're stuck in a healthcare system that is not really addressing their healthcare problems, they're addressing their symptoms.
They're
And that's all they do. They
Yes.
manage symptoms, and they're very good at managing symptoms. But the business, the economic model, is in maintaining that patient with symptoms for as long as they can. We chose a whole different paradigm. We chose a paradigm that we're going to look at what got us here in the first place, which is our root cause. We're not going to manage the symptom, we're going to actually manage the person. Mm-hmm. And right now, lifestyle has become just as critical as any other therapy or treatment out there that we can actually recommend. And the reason for that is because many of the new studies have shown that it's our lifestyle, the choices we're making, that are actually addressing or contributing to most of the chronic diseases out there. So as a functional medicine doctor, as somebody that, besides their training in chiropractic, has expanded that training to be so much more into the functional aspect of things, where do you feel and how is it that we as chiropractors can encourage our patients to pay more attention to our lifestyle choices, and more importantly, maybe even consider expanding our training into some of the functional aspects of it?
Well, it's all about building a foundation, making sure anybody that walks into your office, nutrition, sleep, movement, and we help with that, right? If you don't move, we all know the laundry list of problems that can happen there. Community and purpose. These are super important foundations, and I do feel that we're trained very well in that in chiropractic school, especially in the community aspect of it, right? And understanding how food and nutraceuticals can help add to your patient's recovery when they're in pain, when we're adjusting them, when we're getting them back to health is so key. And again, we had clinical nutrition in chiropractic school. I think there's a lot of great courses out there, and you just got to find what you're interested in and go for it. But never forget the foundations. Understanding, toxins aren't going anywhere. They're only getting more. And just educating yourself and on all these incredible ways that we can either reduce the load or help support our body to identify and get rid of those toxins.
In chiropractic, we've had very few diagnostic tools. In the early stages, it was an X-ray, and now, as you know, less than 5% of all the schools are training our students in X-ray. X-ray has actually gone by the wayside. Right. According to the NCMIC, less than 20% of the chiropractors are still using X-rays on a daily basis.
Sure.
And so, as a functional medicine doctor within chiropractic, what are some of the testing that you have seen that really helps you understand helping the root cause of that patient? Because in chiropractic, we're trained, one of the main root causes is nerve function. right? So we evaluate the nervous system, we evaluate the spine. But from a functional perspective, what are some of the testing that you have identified that really helps you get to the root cause of the problem, so that way your patient can really see, hey, this test says this is not just her word. Right. She actually showed me how my test is showing, and I think that's where functional medicine is really bringing more credibility to chiropractic, because they measure the treatment.
Proper blood work, keyword proper.
Yeah. So what's the difference between your traditional blood work and your functional blood work?
Look, if the standard labs with the standard medication and worked, and the standard primary care visit worked, we wouldn't see the statistics that we're seeing today. No That's disrespect true. To any doctor. But most of what I have seen outside of the functional world is they're testing little bits and pieces. They're not testing to look at the whole picture. So we test to look at the entire picture. And it's not just blood work. Stool, saliva, urine, look at toxins. So we're truly looking at the whole picture and how things are communicating. Micronutrient panels. Oh my goodness, really understanding. I say, if you don't put gas in the car's not going to move. That's your equivalency of a nutrient deficiency, right? We can't support your spine and your bone health if you don't have the right nutrients supporting your bones, right? So a lot of it is that, and a really good physical examination. I understand a lot of virtual visits came about with the COVID pandemic, and I was thankful for that, but nothing replaces a really good physical examination. There's just so much I can tell about a person by just head to toe looking at them.
Dr. Blundy, as we move through, and the people that are listening right now, they really have an idea of where they want their health to go oftentimes, but they're not getting there. And they're getting frustrated because the system that they're in, the doctor, like you said, they'll listen, and then the patient will say, and then there's this. And what was interesting is kind of watching the research. It's 5 minutes of a primary care medical physician talking to a patient, 5 minutes of the patient telling them the symptom, and stopping them if there's more than one. So that patient that you described, it hurts here, here, and here, and here, they're going to focus on one. We need to focus on one area. And then that 5-minute transaction is often literally a financial transaction, which is, Dr. Fab, I have a diagnosis for you, and it's going to include you fulfilling this prescription because this is what I think you have. I think it's really frustrating when a patient leaves an office and gets told they have a pain diagnosis, because pain is actually a symptom, yet we've made it a diagnosis, and the World Health Organization is saying, here we are, our number one disability in the entire world is back pain, which would then tell us we have a problem because we're actually saying the number one disability in the entire world is a symptom.
Yeah. Yes.
How would you say walking into your office is different than someone like I did talked about come in and say, it hurts here and here and here? What happens in your world in that transaction?
Well, my visits typically last between an hour and a half to 2 hours, because I have to ask a lot of questions. Besides the typical, when did it start? I go way back. There, most of the time, unless it's a very obvious trauma, there's a multitude of things that have led up to, I have pain here, right? And if that is, I don't know, it started 3 months ago, I didn't do anything, that means you got to do more investigating. That means you got to ask a lot more questions, because that's telling you one thing probably didn't get it there. Right. So it's our job to be able to ask those questions, because it might require more than one type of treatment to help support that patient, or telling that patient to avoid or do things differently when they leave your office based on that. So being able to have that time, which unfortunately, and I believe in the world of insurance, causes a huge problem with that, you need to have the time to be able to ask those questions and get the whole picture in order to really give your patient a treatment plan. And also, working together with other doctors is really what it's about. I love working with other doctors. I love having a team of people that can help support my patients. And so I encourage that as well, besides asking more questions. Get a team, work together, brainstorm.
Well, what I love about it is the fact that we are all bringing our skill set to benefit that patient even more. There's only so much any of us can learn within a school system. Mm-hmm. Some of us are very avid learners after school. Some of us just do the bare minimum just to keep our license. So it just depends on the kind of personality, but bringing that team, and we're seeing that in chiropractic, integrative care has grown tremendously, where they're now adding multiple providers in the same office to try to support our patients.
Yeah.
So we see that trend rising over the last 10 years, and I think that's only going to continue to rise. But also, don't forget that we have other providers in your neighborhood that can also be great allies for you, not just for they get a second opinion, collaboration within that patient, but also remember that you're building trust. And as you build trust, then that individual is going to refer a patient back to you. In practice, my two biggest referral sources were two MDs that became my patients. Sure. Learn about the service of chiropractic, the value of chiropractic, and they would just send me so many patients every week because they couldn't help themselves, because they were exposed to something.
My partner, by the way, in the functional medicine clinic that I have is an MD. She started off as my patient. She came in, she worked in the neonatology, the NICU, and standing all day and saving babies' lives hurt her back. She's like, I can't be medicated. Came to me as a patient, and now we built a center together.
Wow.
Excellent, excellent. And I think this is one of those drive home moments. The fundamental opportunities that have changed over the years is that in the past, there wasn't a lot of collaboration. It wasn't a patient-centered moment. And now we're moving to the future and having that collaborative team and a coach, like a chiropractor, you know, the architect of trying to figure out how do we collaborate and celebrate this patient, because they're in the middle and they want their doctors to talk to each other. And have you reached out to other healthcare providers in your neighborhood? And if so, how did you approach that?
The answer is yes. I will try to make this short, but I was very lucky that when I first started my associate, I worked in the city, and I worked in a chiropractic office that had already been integrated. So there was an orthopedic surgeon, there was a physical therapist, and we all worked together. And not only did we help so many patients, but we built a bond outside of the office. Because like I said, if you truly care about your patients and what you like to do, you will come together to do it. So when I opened up my own practice in New Jersey, that was one of my missions. And I ended up just calling up the head of neurosurgery at Hackensack, Dr. Pat Roth, and we had a half-an-hour conversation, told me how much he loved chiropractic, which is not something you normally hear from a neurosurgeon. And over the last 10 years, he was very supportive of it. All of his doctors were, and actually we share space now in a center together. So we are actually working together collaboratively. And I cannot express that working together as a team is so important. Pick up a phone, talk to somebody, whether they're an MD, a DO, podiatrist, a dentist. If they truly care about taking care of patients, they're going to want to listen and hear about how you love to truly take care of patients.
Well, we noticed that functional medicine has been around in chiropractic for quite a bit. Didi Palmer talked about function, BJ Palmer did too. We're seeing, especially at A4M and in some of the other, a lot of medical doctors have jumped into the functional medicine bandwagon. They want to expand their services, and rightly so. They're actually frustrated.
Sure. Many
of the doctors that I know, they feel like somehow innately they know that there's more to the story that they've been sold as a traditional provider. So they've expanded their training. So now they have a certification or a master of functional medicine. But also at the same time, I'm seeing that many times their philosophy of prescriptive, they're chasing symptom, but they're calling functional medicine. And we also see chiropractors getting certified in functional medicine too. in your opinion, what would be the best possible way to maintain the integrity of functional medicine to become something that is more about the root cause, is more about the natural health sciences, is more about the lifestyle, rather than always just thinking about the profit?
So that is going to be, I apologize with that in the background. No matter what you said it, root cause. So whether they're an MD or a DC trained, somebody who is going to be looking at the root cause instead of quickly giving you a prescription or quickly giving you a nutraceutical is going to be what you're going to look for. And you will know that at your first visit or when you call a practice. So when you call a practice, what they're supposed to say is medication and nutraceuticals are in their tool bag. That's their tool bag, and they have a whole bunch of things, but learning what you're putting in your body, getting all of your symptoms, understanding the root cause, looking at you as a whole person instead of that symptom, that's how you know that you're in the right functional medicine place. If not, keep searching until you find one.
Well said. And I love that we wrapped it up with a collaborative effort. If you're out there, build your team. That's a big piece. And I also want to thank Dr. Blundy for sharing her knowledge, her wisdom, the time and the love that you give to the profession is fantastic. It is such a pleasure to be with providers like Dr. Blundy who are there as functional medicine providers, but chiropractors that want to make the world a better place for you. Now, if you're looking for a doctor of chiropractic, well, you can visit f4cp.org/find a doctor.
Well, I love that because, there's many of you out there that are probably so inspired by some of this interview, especially after hearing Dr. Blundy, that you want to go see a chiropractor or maybe even consider finding a functional chiropractor. And I want to thank you for tuning in. I want you to know that we'll be right back after a quick break for our last segment of the day, so stick around. I don't want you to go anywhere. Make sure that you stay right there, and don't forget that your dollars are currently being matched by one of the incredible sponsors, Biotics. So that means that every $10, $100, $1,000 you give us is going to be matched 100% by Biotics. So please don't waste this opportunity. Double the money that you're giving us, because all of those resources is what's helping us spread the word of the value of chiropractic. So I want you to know that we appreciate you for being here. We'll be right back.
Hi, my name is Dennis DeLuca, the president of Biotics Research. In the late 1950s, my cousin was diagnosed with a serious illness, and my father became determined to help him. The prognosis was not good, but through science-based nutritional intervention, my cousin's quality of life exceeded medical expectations. It was that illness that brought several family members together, which led to the founding of Biotics Research in 1976.